Okay,
And
so as I
last but not
said
least,
last
we
week,
have phosphate.
hey guys, lots of material today.
This is
I really
essential
need you to
for
focus
function
and
of the
minimal
muscle,
side
the red blood
conversations,
cells,
please. I don't
and the
like to be
nervous
bossy,
system.
but there's so much information.
These are just the
and
functions you can read here.
it's
It's important for
distracting to me, and I'm
acid-base
sure it's distracting to other
buffering.
people. I've actually had people tell me it's distracting.
Metabolism.
So please, 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 if you have something you need to deal with, I'm not going to get upset if you need to step out, but please just stick with me today. Okay, so phosphate, essential to function of muscle, red blood cells, and nervous system. It's part of the acid-base buffering system and all these other functions here. So metabolism, helps with uptake of glucose. Do you remember the relationship between phosphate and calcium? I like that. I like the arrows here. Yeah, so they're kind of, I think about like a teeter-totter. So if one is up, the other one is down. They have this reciprocal relationship.
And for the interest of
And
time,
so
I'm just going to record this.
What
little
are
part
a couple causes?
like,
I know you had this. I talked about it briefly last week, and then you also had
I'm good.
human needs the day after. So what are some causes of low phosphate? Malnutrition? Is that what you said? Okay.
Well, I'm going to record it
Perfect.
to make sure I don't rush through it
spell.
too.
Yeah, I can.
Because we're also out of time.
Malnutrition.
Biggest picture here that I want you to think about
diarrhea.
is phosphate it acts in the opposite way.
So GI losses.
Remember?
Calcium.
So we have a
Phosphate binding an acid.
reciprocal
So
relationship.
phosphate
So
binders,
if
which
calcium
kind of
is
makes
high,
sense.
phosphate is low. And so if phosphate's high, calcium is low, and that's really the reason people with renal failure have low calcium. Is
High. What's
phosphate.
the number one
so
cause of
phosphate
high
binders
phosphate?
that people with renal failure have to take multiple times a day. And that
Kidney
the point
disease,
of that
which kind of ties in with today. It's part of the reason I thought let's finish this up today because it has a big role in renal failure too.
Make that prettier.
So
and I'll
acute kidney disease or chronic kidney disease. So any renal impairment, especially chronic, or excessive intake, which is true for anything. If you it kind of makes sense, right? Excessive intake of potassium, you can have high potassium, magnesium, phosphate. So excessive intake. Or low parathyroid hormone. PTH. So manifestations or signs and symptoms for low phosphate, we can have CNS depression, and think about what this sounds like: muscle weakness and pain, osteomalacia, or kind of weak bones. So what does muscle weakness or fatigue remind you of from last week? Which mineral? Calcium. So it's reciprocal. I think it's a nice way to remember it, right? So if the relationship between phosphorus and calcium is reciprocal, so are the manifestations. So symptoms of hyperphosphatemia are similar to hypocalcemia. Anytime we can make connections between different things, it helps us remember it, and hopefully it just makes sense too. So what were some symptoms of hypocalcemia?
Muscle twitching.
Yeah, so tetany, muscle twitching. What's this sign? Tapping on the facial nerve. Causes a smile. Shavacheks. I'm probably saying it wrong. I apologize. What about this one? Trousseau's. See how we can tie these together? Is that nice? Okay. And it just remember that reciprocal relationship and the manifestations. Okay, so similar to symptoms of hypocalcemia. And we can also get calcium deposits in soft tissues, joints, arteries, or kidneys. Kind of ties in with kidney stones, we'll talk about today. Tissue, joints, arteries. Doesn't sound good to have calcium in any of these areas, right? And this can actually cause organ dysfunction, especially renal failure. So how do we manage anything that's low? We need more of it. This is nice and straightforward, right? So supplementation. And if somebody has diarrhea, what do we need to do? Stop the diarrhea. They're going to keep losing it, right? So treat underlying cause. What about hyper? Especially knowing that there's some really dangerous potential side effects. So again, treat underlying cause. I'm going to put this for both. What if it's really high? What's the only way we can, and somebody has renal problems, what's the only way we can actually really remove it? Dialysis. So that would be if it's an emergent thing or if the kidneys are just not working to be able to eliminate. There's phosphate binders. Phoslo is something that pretty much that's just the name of a phosphate binder. It's something that pretty much every person with end-stage renal disease is on. And then we also need to treat or correct low calcium if there's hyperphosphatemia. Correct low calcium. Okay, so that is our little honorable mention for phosphate.